Hi, I'm Janelle, cosmetic nurse practitioner since 2013. I have not been live in like a week, so I am back here to answer your questions. Botox, filler, skin, hair, we can go through it all. I have 3 medical spas, Jossie Skin and Wellness. You can find us in Los Angeles and Las Vegas. This is me prior to doing any treatments, before any work done. This is me present day. This was over 10 years ago. I am now 38 years old. I've got 3 babies, and we're going to talk until they knock down the door. If you have questions, please let me know. Any questions? Hey, Rita, I hope you're doing so great. Let me know any questions you have. In the meantime, I will talk through the most commonly performed treatments that we do in our office and the most commonly asked questions that we receive in our office. What we really focus on is natural looking aesthetic results. We treat all skin types, all skin tones. I hope you're doing so great. All skin types, all skin tones. And I say that because not every clinic does. We are really thinking about you, your natural features, making sure you look balanced. We don't want every face looking the same. That is never our intention. We have a big focus on skin health, hair health, and then we have natural filler. So PRF, all natural easy gel filler. This is a filler alternative made entirely from your own blood's growth factors and stem cells, where your body makes new collagen over time. That is probably one of the most commonly performed procedures in our office, aside from our skin treatments. Skin treatments we offer are Aerolase laser. Anything I mentioned is going to be safe for all skin types and all skin tones. So Aerolase laser. Hey Lex, I hope you're doing so great. Bio repill, chemical peel, skin pin microneedling, and the hydrofacial. We also do Botox filler. We really think about your entire face. We're not here to just spot treat. We're not here to just treat the smile lines and ignore the rest of the face. We're really thinking about how the face is aging. We're thinking about your features and how they are balanced in relation to one another when we approach your care. We build out treatment plans with you in mind, in conversation with you. Again, focusing on skin health, hair health, and natural looking aesthetic results. So questions you have, please let me know. I will start talking to you about the natural filler. This is the one I have been doing the past 2 years. I have not had any regular filler in my face for over 3 years. I love filler. I'm not trying to diss it. I'm just breastfeeding, and I was pregnant. And I'm still breastfeeding this baby that will probably be coming in here soon. So I'll talk to you about the natural filler. A lot of people don't know that this is an option. Okay, so the natural filler. This is PRF Easy Gel. This is when we're drawing blood from your arm and then we spin it in the centrifuge. It separates out your platelet-rich fibrin or platelet-rich plasma. With that, this is your stem cells, your growth factors. We take that, we heat it and cool it, and so it comes into a gel, and then we inject that anywhere in your face. Wherever we inject it, your body will make new collagen over time. The most commonly performed areas that we treat or that people ask for are underneath the eyes and into the smile lines, but you can really put this anywhere in your face. Today I had somebody do her under eye smile lines, her lips. I've had people do their temples, their chin. I've done my whole face with it. Okay, let me see. JD, thoughts on tretinoin versus retinol? Not sure which to ask for wrinkles. So using a retinoid is going to be great in turning your skin cells over faster. That's going to help with fine lines, pores, skin texture, dark spots, collagen stimulation. You can use either. If you have never started with one, it might be a little bit more tolerable to use a retinol. See how your skin tolerates that. And then after like, hey, I'm okay with this, you can go into the prescription form. The prescription one doesn't have any buffer in it, whereas most retinols will be able to have some like hyaluronic acid, something to make it not so like irritating to the skin. Because it's turning skin cells over faster, that's where people will notice that they get a little bit more itchy, a little bit more dry. A lot of people, they don't know how to use a retinoid appropriately, and they go in using it way too fast, way too strong. And so then they their skin like gets dry and itchy and they're like, oh, that wasn't for me, or they get really red. So the biggest thing when you're using a retinoid is go slow when you start. I tell patients start 2 to 3 days a week, skip days in between, and then use a moisturizer. You can use it before and or after you use your retinoid. So if you do it before and after, it's kind of sandwiching, that's what we call it, so that it's not so dry. And that's how I'll tell the patients to do it. They tolerate it way better. And then once you're okay with it a couple days a week, you can do 3 days a week. Once you do that for a few weeks, you're like, oh, my skin is tolerating this. I'm not too itchy, not too dry. Then you can do it 4 days a week, working yourselves up to when you can do, some people can do every single day with a retinoid. Main thing is we want to do multiple days, but slowly bring it in. How often do people have to do the PRF? Does it last longer than fillers? So with PRF, the natural one we were talking about earlier, that is made entirely from your own blood. We want to do a minimum of 2 sessions, mid-30s plus, I say, or depending on how much volume loss you have, you might want to do 3 sessions. You spread those sessions about 1 month apart. We want to retreat the same area. So you don't want to be like, oh, this time I did my under eyes and smile lines. Next time I'm doing my temples. Like retreat those same areas, stack them on a minimum 2 to 3 sessions. And then after that, let it sit for a while and see how your body is making that new collagen. It can take up to 6 months for your body to produce new collagen. So just know this is not an instant effect the way, you do regular filler. You can see an instant result. Do you say, does it last longer than regular filler? So your regular filler, I say between 1.5 to 2 years, that's when you're going to come in for maintenance. With the natural filler, I expect you to come in around 9 to 12 months for maintenance. It really just depends, again, how much volume loss you have. If you have a lot of volume loss, you might be coming in sooner. But it's like your body's making new collagen, whereas with regular filler, your body's not making collagen. The natural one is made entirely from you. So a lot of people like that because nothing else is mixed inside of it except their own body's stem cells and growth factors. Okay, Hey M said, what can I do for deep 11 lines on the forehead without doing too much or being frozen? So if they're really deep, you can do Botox in here to prevent these muscles from flexing so hard. How much Botox you do really depends on how strong your muscles are, how big the area is, what you want the outcome to be. So if your muscles are really strong and you want to be more restricted or more frozen, that's when you would do more units. If it's your first time, you want to test out the waters, you can do less. When you do less, just know that it doesn't weaken the muscles as much and it doesn't last as long. I mean, you guys might hear my kids, so at a certain point I'm gonna have to run and get them. A lot of people, their first time when they're getting Botox, like, I just want to go light, I don't know, I want to see how I respond to it. Their second time, they're like, freeze my face, like I get it now. Even when we say freeze, they can still move. I just saw a patient the other day, I saw 2 patients, I've seen, but these are 2 patients that they had like 150 units, and I saw them a year ago, and they're like, I'm back. They're like, that lasted me 10 months. That lasted me 12 months when they do a lot of units. And they're like, people get so afraid of doing so many units. They think they're frozen. They're like, I still have the ability to move. I have the ability to show emotions, but it does last me a lot longer when we do those higher doses. So instead of them coming back every 3 months, every 4 months, they're able to come once a year and like have their dose and let it ride out. So that's something to just know. I'm not afraid of doing higher units when I treat people. If they're okay with it, depending on what they want, their goals, it just lasts longer. So that is really nice. Okay, let me see. I've got a lot of messages here. If you have questions, please let me know and I will help answer them. Okay, are you available in LA before Christmas for Botox injection? Tavi, I should be able to do that. I think I have 1 or 2 more clinic days. And if not me, go see my team. The team is excellent, excellent, excellent. If you call or text the number at the top of the page, my team can help you with getting scheduled. Okay, let me see if I missed any. Okay. Hi, love. Why does nose Botox wear off quickly? I feel like it only lasts for a few weeks because we're not doing huge doses there. So if you up your dose, it can help. Depending on what areas you're treating, when we do the nose, areas that are most commonly performed will be like right here. So bunny lines when you scrunch, if you have those. The nostrils for flaring. So to prevent the flaring of the nostrils, some people will feel like their nose looks a little slimmer because it's not flaring out. At the base of the nose to help prevent the tip of the nose from curving down. So usually those are like the muscles are smaller, so we're just doing less units. You can do more units to have it last longer. Okay, I want to get Botox. Newbie here. Hey, Kat, I think you will love it. Biggest things, talk with your provider about your goals. Your provider should be assessing your muscles. Everybody just doesn't get the same dose. So I'm looking at, like today I had a patient, her first time getting Botox, and she told me she's like, oh, I was acting, I took a break, I'm going back into it. I was like, okay, what type of roles are you going for? That helps me kind of determine how are we doing this. I'm like, are you the mean girl? Do you have to be frowning at people? Or are you like the nice, happy girl? Like you want no frowns. Basically communicate with them like what your goals are. They should be assessing you. When I'm talking to patients, I'm like watching how their faces move. Do they constantly frown down? Are they raising all the time when they're talking? In my mind, I'm thinking if they're always opening their eyes like that, they use this forehead muscle a lot to lift their eyebrows. So I have to be careful that I don't freeze them here or it might feel heavy. Does one of their brows go up more than the other? What is their emotions? I ask about their job. I ask about what they want. And then just know your dose could be completely different from what your best friend does, what your mom does, what your sister does, because we're making an assessment of your face and your goals, how big your muscles are, how strong they are, what you want the outcome to be, how long you want it to last. So the people that want to come once a year, they do a lot more. And yes, their bill may look higher up front, but they come once a year as opposed to people that are coming every 3 to 4 months. So it just depends on you and your goals. Communicate with your provider about what you're looking for. Okay. S said, I have smile lines and I've had them since a kid and 29. I don't want filler. What should I do? Do the natural filler. So the natural one I was talking about earlier is made entirely from your body's growth factors and stem cells. We draw blood from your arm, 2 tubes, spin it in the centrifuge. Nothing else is mixed inside your tubes. Nothing else. It's just empty tubes, but we separate out your growth factors and stem cells, heat it and cool it, make it into a gel. Wherever we inject it, your body will produce new collagen over time. So it's a natural way to soften the lines without looking overdone. You're not going to have any allergic reactions to it. You're not going to have lumps and bumps. It's just not the instant result that you can get with filler. But I do really like that if you're 29, like I'm like the younger you start, like in your 20s, early 20s, which is not even early 20s, but like in your 20s when you're starting to see these signs of aging, usually like 28, 29 into the early 30s, starting to see these early signs of aging. So it'll be like smile lines getting deeper, little shadows at the corners of the mouth, the under eyes start to look a little bit more hollow, start to get this little line through their cheek. That's when we want to be using the natural filler before things are like super, super hollow. You know, sometimes if you've come in and you have a lot of volume loss, a lot of fat loss, doing the natural filler is just going to take a long time to try to regenerate that collagen. So you got to assess your face and your goals. Okay, Saab said, I'm looking to get Botox or something for my face. I'm 47 and it looks like my face is drooping. Yeah, so we can just totally do an assessment and we can do a virtual consult. During this consult, we go through your questions, your goals, tips on what to expect, how to prep for treatments, build out a treatment plan. So we start building that treatment plan out during the call. And then when we see in person, we'll say, okay, like based on what we discussed, hey, here's how I want you to prep for your appointment. Here's how we're going to start your treatment plan. These things are not done in just one session. So I tell people, I'm like, give yourself a minimum of 2 sessions when you're doing your filler. We never want to overfill. We don't want to rush your treatments. You know, you got to think you didn't age overnight. We want to do this in a gradual process so you look the most natural. But yeah, do 2 sessions at least for your filler. We're going to kind of break that up over a couple months. And then we can decide later if you want to do some more. We want to think about your full face and how it's aging. When people are talking about sagging, usually it's because we're losing volume starting from our temples. So things start to get hollow here. These fat pads start to separate. So we'll get a line from the under eye and through the cheek. The smile lines look deeper, the corners of the mouth. And then everything starts like pushing down, down. This does not look great. And pushing down and making like this little jowl fat pad right here as well. So that is where everybody feels like everything is sinking. We will use strategic filler or natural filler placement to help things look lifted. It's not a facelift, that's actually going to pull you back, but we're going to help like revolumize certain areas and create a highlight so things look lifted instead of looking most of the highlight down there, like at the forward part of the face. And then we're trying to soften shadows and lines, not get them all the way gone. If we try to chase and make there to be no smile line, your face is going to look blown out. So we just have to look at your face and do an assessment, build out the treatment plan, start chipping away at the treatment plan. But we're not just here to do one line and call it a day because the whole face is aging. Me and my team, when we're doing your injections, we're thinking about underneath the skin, where those fat pads are separating, what's happening, like to all the muscles underneath, the fat pads, everything. We're not just like saying, oh, here's a line here. Like, what is causing that? That is how we inject, so you look the most natural and not weird and overdone. Can retinol tighten the skin underneath your neck? Jana, yes, do it underneath your neck. You want to sandwich this. So use your moisturizer before and after, because the skin on the neck is thinner. You should also do it on your chest. And so it's just it could be a little bit more dry or irritating. It is not tight like that, but it does help with the texture. Do this, and you're going to want to do it long term when you're using your retinoid. Definitely use your sunscreen here all the way down the back of your hands, everywhere, when you're using your retinoid as well. Okay, I got a 4-degree message. I'm trying to go faster, guys. I'm 44 and want to try Botox. Any suggestions? I think you should try it. I think most common areas people will try first are like their frown lines, horizontal forehead lines around the eyes. But there's way more areas that we can treat on the face. Sometimes people will do it, like I mentioned earlier, for the bunny lines, these little lines here. They'll do it for nostril flaring. They'll do it for gummy smile, and they smile if their lip goes up and they want to not have their gum show as much. We do it right here. It'll kind of lessen that lip from raising. They can do it above the upper lip. That's called a lip flip. When their lip curls in, when they smile, this prevents the muscle from curling in, so they can do it there. We can do it at the corners of the mouth for somebody that makes sad face all the time. Can prevent that sad face. We can do it into the chin for dimpling to help smooth that out and very slightly prevent the muscle from curling up. So it gives you a little bit of length. We can do it into the neck bands, into the neck. So that'll help tighten along the jawline and helps these little bands. Some people, when they talk, they can see these neck bands showing. So that'll tighten. And then we can do it into the temporalis muscle and or the masseter muscle. Both of these are for clenching and grinding, TMJ symptoms, headaches. They can do that there. This can also help slim the lower face. And those are the most common areas in the face. I also do it for people in the palms of their hands for sweating, the soles of their feet for sweating, underneath their arms for sweating. I do it into the neck, into the trap muscles for tightness, so they feel really tight or bulky there. Where else? I mean, I've done Botox into the calves for slimming. I've done Botox into somebody's groin for sweating. I have Botox like everywhere on people's bodies and my own self. So yes, biggest thing is just like talking to your provider about your goals, so that they can approach your treatment plan with you in mind. Some people, when they talk to me and I'm asking them all these questions, you guys see, I can't even give like a one-word answer. There's a lot that comes to your treatment plan and like how we approach you. So I have a lot of questions, and sometimes people are like, whoa, I've gone to get it Botox for 7 years. Nobody's ever asked me this. And I'm like, oh, that's not good. We're not just like randomly putting stuff in there. There's a lot of thought that goes behind it specific to your face. Okay. Let me see. What if I want to do facial balancing? What does that include? Facial balancing is basically a customized approach to your skin treatments, to your injectable treatments, making sure that your features look harmonized. A lot of times when we see people that look weird on the streets, is because something is a little off. And I will tell you, a lot of people inject, or they try to go get injections, and they're focusing on one thing. They're focusing on, smile lines. Hey, I see these lines are deep. Fix these smile lines. So what happens is their injector gets all the smile lines gone, but still their face is like sagging here, like their cheeks aren't lifted. So it looks weird when we're seeing them on the streets. We're like, oh, they look like they got Botox and filler, because they're only treating one spot. Or they just get their lips done, and their lips look juicy, but then they got these sad corners here, and their chin is set back, and their lips are protruding past their chin. And then the common person walking by them is like, oh, they got their lips done. That looks weird, because they haven't framed the area. So this is why I say, when we're talking about facial balancing, it is looking at the full face. I tell people, the world is not just seeing you from the front. They're seeing you from all these different angles. For me, I'm like watching how your face moves. I'm thinking about all the things. How are you using different muscles to animate, to express what is going on? How are some of these muscles compensating? Maybe, like I said earlier, some people use this muscle a lot to try to lift their brows because their brows are low. And so they're like always opening up. So they're using this forehead muscle. So I'm like, oh, that person needs some brow lift, and I need to do less on their forehead, or else they'll feel heavy. So facial balancing is just looking at your features, looking at your muscles, thinking about how everything fits together so that you look the most natural. If you see us in our clinic, oh my goodness, all day, you walk in, I will see an old white woman, a young black girl, a Latin girl, a mixed girl. Like, we see all the ages, we see all different types of faces, and men and women every single day. And like, I can't do the same exact thing from that person to the next person to the next person. Everybody has a different treatment plan. It's going to be specific to you. We don't want every face looking the same, and we can't approach every face with the same treatment. So that is something that is very important. This is why you gotta pick and choose the right provider. Also, guys, like this past week, I have seen a few patients that I had over the year, like 2022, I saw them, 23, and then they come back and they're looking a little off, and I'm like, oh, like, I haven't seen you in a while. They're like, I went to some person, and like, now they're trying to come to me to dissolve and fix it. And I'm like, what happened? They're like, you were booked, or like, they were $50 cheaper, and I went over there to them. And then they're like trying to dissolve it. So I'm also like, don't rush it. When you're choosing your provider, go to somebody, stick with your person, communicate with your provider, your goals, help your provider to be better. Don't jump around. When you're jumping around, then I'm like, dang, now I'm trying to dissolve and fix something. I don't really know what they did. I'm like, go see them to fix it. And they're like, no, I don't want to go back to them. They messed me up. Anyway, I'm just trying to say, like, have a relationship with your provider. We ask a lot of questions. If you come to our team, we know a lot about our patients. We're not just looking at your face. We're asking about your background, what you're doing, what trips you're going on, what you're getting ready for. Oh, you're planning to lose weight. You're not planning, like, all the things. Today, a girl was like, I got a new hairstyle, or I'm planning to change my hairstyle. I'm planning to lose weight. I'm like, okay, if your hair is going to be different, like, we're looking at all things. So just talk with your provider. You should be having like a say in your treatment plan, like a deep say, like ask questions, know what's going on, just have an active voice. You don't want people just doing random stuff to your face. And they should have a very specific reason about each and everything that they do to you. Okay, let me see. Can you do natural filler in your hands, Joanna? Yes. Sorry, I'm trying to scroll back up because like the questions are going. So if I'm missing you, I'm not trying. It's just, I talk too much for one question. Shantae said she has the same problem. What did you try to do? Giles, is that what she's saying? She said, hey. Okay. I don't even know what these are. I'm trying to scroll back to where I was. Do I have virtual appointments? Yes. I told my team to add some more because they were all taken. Me and one of our other nurse practitioners, Samantha, is also on there. Samantha is so thorough and she's so great. You can see any one of our team members. You guys are excellent. We start going through those questions, start building out the treatment plan, help you prep for your appointment. So when the patients come in, they're not like, hello. Oh, like we already have rapport with you. They've already, stopped taking their blood thinners, alcohol. They've already started taking arnica, pineapple. They're like ready. They've stopped their active ingredients. So they're ready for their skin treatments. They haven't been laying out in the sun. We've made sure that the timing of their appointment is right for, they're getting ready for this event or this flight. So they're not showing up bruised and swollen for events. So this is why we do the virtual calls before, so you're prepped. We go through pricing. So then they're able to know, okay, this is what the pricing is going to be. We have financing. They're able to pre-qualify for financing. So it's not like, they come in. We're not here to make rush decisions. We want people to make informed decisions. So this is why we do the virtual calls, to have our patients ready and prepped. Okay, Jackie, do you think 4 syringes in the chin is too much? Depends on the product, and it could be a lot in one session. It doesn't mean that they might not end up doing 4 syringes, but I think 4 in one session could be a lot, but it does depend on the product. When we're doing chin, I tell people it's not just filler right here. We're not just trying to do this part. If we only do this part, it's going to look like a ball of filler. It's going to look weird. You got to connect it to the sides. You got to connect here. We've got to bridge it. So that's why it can take multiple syringes. It also depends on how far back your chin is set. If your chin is more set back, more recessed, it can take more syringes to get to the goal. 4 in one session is kind of a lot. It's not like unheard of, but I would probably break it up into 2 sessions. When I do filler, or my team does filler on anyone in any part of the face, we say, do some, let it settle, reassess in 6 to 8 weeks. We can always add more if you want. We just don't want to do too much in one session so that it doesn't look overfilled. That's the biggest one. We don't want to look overfilled and weird. Actually, the biggest one is safety. Safety when it comes to filler. What we're looking for is that we don't block blood flow off. Think we've got whole blood vessels, our whole face, our whole body. We don't want to just be shoving filler in. Too much filler, either into a blood vessel or like compressing against a blood vessel can stop blood from flowing. If it stops blood from flowing, you could have extreme pain, vision issues, your skin color could look pale. We would need to dissolve that because we don't want to stop blood flow in the face. It could end up in tissue death. This is super, super rare, but I explain this to each and every patient before they do treatment, even if they've done treatment several times, just because we want to be mindful of these rare risks and we want to be able to intervene, know how to intervene, what to look for, how to take care of it. We would dissolve it. As long as I've been doing this, guys, I've been doing this I've only been doing this since 2013. Like, this is what I do. This is what I do. This is what I study and know in and out. So 13 years going on, and I've never had to dissolve anybody for any emergent reason, any part of their face, any filler. So super rare, but you still want to be mindful and equipped to handle those rare emergencies. Sorry, Jackie, you just asked if 4 syringes was too much. You guys see, I got a lot to say. I'm trying to have you be thoughtful about this. I know a lot of people, either they just don't know and they just think like, oh, it's just Botox, it's just filler. It's not just. There's a lot that goes into it, a lot of thought, a lot of safety concerns. This is what I want you to know. I want you to like be equipped and be mindful. Okay. I think I got back to where we got to the 47 and they were looking for something for their face to be droopy. So I think I got back up, but there's probably 50 messages. Hi, Jessie. She said, good evening. And we talked about virtual appointments. Okay, Brintigne, I want wrinkle prevention and glow. I don't have acne. Scared to mess up my face. What do you recommend? Start with your sunscreen. Start with your retinoid at home. Doing that part, doing your skincare is like such a big part of it. In the office, more preventative treatments are going to be our skin treatments like the Aerolase laser, the Bio Repeal chemical peel. No downtime with those two. I love them. I do them all the time. I'm doing something on a monthly basis for my skin. Skin pin microneedling, also great for collagen, for skin texture. A little bit of downtime with skin pin microneedling, about 5-ish days. You're probably redder, like reddish, pinkish for like 2 to 3 days. Get a little dry, flaky, around 5 days. But those are good things. But like I said, at home, if you can only do one thing, sunscreen, guys. If you don't ever want to get Botox filler, that's totally fine. You don't have to do any skin treatments, but just wear some dang sunscreen to prevent skin cancer. Retinoid, then start your skin treatments. You can also do the natural filler made from you, your blood cells, your growth factors and stem cells to help make new collagen. Common areas, people will start to see signs of aging underneath the eyes, into the smile lines, the corners of the mouth, this jowly area. So we're trying to like use those as like a fertilizer long term. So, or like preventatively. Okay. I'm going to keep scrolling to see if I have them. Dysport, where to Botox? Yes, you can use, in our office we have Botox, Dysport, Xeomin, FDA approved in the US. We also have Jeuveau, Daxify, Ledibobo. So there's different brands of Botox. I tell patients you can try different ones, see if you have a preference on one. They all have done their clinical studies to say, oh, it lasts 3 to 4 months. And most people, if they have moderate to severe frown lines at this dose. Now, the dosing is going to change each face I do. I have some people that will do way more than what they did the clinical trials on, and I have some that will do way less. It just depends how strong your muscles are, how big the area is, what you want the outcome to be. So that's how we go about dosing. I lost 80 pounds. What to do about hollow under eyes and a turkey neck? I am 54. Hey, Angela, I hope you're doing so great. Hollow under eyes, you can do filler or you can do the natural filler. Traditional filler, you're going to get the immediate result. I think that's one of the biggest, that was one of the first things I did. I had lost a lot of weight after having my first baby. I've got 3. I'm surprised they haven't been knocking on the door yet. This was after my first one. Oh, he's 11. So this was probably like 10-ish years ago. And I had lost a lot of volume here, under eyes, cheeks, all the spots. I use filler for that instant result. Now, right now, I'm still breastfeeding this baby that I have. He is 2. And so I haven't been doing filler because you can't do this when you're breastfeeding, pregnant, and all that. So I've been doing the natural filler. The natural filler has helped me not to revert back to this because I haven't done regular filler in over 3 years. And I'm now 38 and I was 28 here. So it's helped me, my body, make new collagen to not look so haggard. These past 3 years, not having filler and having this baby eat a cheeseburger and then come suck the life out of me. He is big and he's still drinking. But I don't look so sunken as I did before. Okay, so I would do those. And then turkey neck, your retinoid, your sunscreen at home, do that. And then you can do Botox to the bands to help. You can do microneedling or the chemical peel and or the laser. Do your skin treatments, guys, not just your face, but your neck, your chest as well. That's going to help with the texture of your neck. And then you can do dilute Radius. So Radius is a calcium-based filler that has collagen-stimulating properties. In the United States, Radius is the FDA approved to, like, for the jawline, for the cheeks, for smile lines. It's the thickest filler. It has the most lift of all the fillers. However, they've done really cool studies worldwide where they take Radius and they thin it out. So instead of it being so thick and like trying to give me lift through my cheeks and my chin and my jawline, when we thin it out, it's kind of drippy. But what we're doing is you can put it into the neck, into the skin, anywhere in the face, and your body will make new collagen wherever you place it. So that's another thing you can do. I've seen really pretty results in the neck with the dilute Radius. At a certain point, if it is a lot of like hanging skin, I'm going to tell people, I'm like, hey, go get a surgical consult. If you're open to doing surgery, talk to them, because that's going to be the only way to like pull it all the way back. But for the ones that don't want surgery, I'm like, there's a lot of things we can do non-surgically to help improve the neck. I just know there's limitations with some of these things we can do non-surgically. Okay, I hope that answered your question. I know I talk too much, guys. Thoughts on microneedling? Teresa, I like it. That of all the treatments, only me specifically, I probably do that the least, just because I don't like the downtime for me specific, because I'm always on here talking. I'm seeing patients in person and I wear a mask, and so then it gets itchy. I got kids and their dirty hands and they're touching my face. My hair is touching my face. Like when you're doing microneedling, you want to be kind of mindful for like about that first 5 to 7 days. Infection control, really the first 48 hours. We don't want anything getting inside those little micro injuries on the face. So I gotta have hair off my face. My kids can't touch me. You can't have any makeup, all the things. So for me, that's the only reason why, just because I'm like on the move all the time with these babies and filming and all of that and the patients. So I do the ones with least downtime. However, people love microneedling in our office. Safe for all skin types and all skin tones. They do it especially for like skin texture, for collagen stimulations. People love that one. You can see probably like the best, if they're really coming in for acne scarring, like heavier wrinkling, I'm like, do microneedling. Also, a lot of our patients come in and are stacking it the same day with their skin pin microneedling, with their bio-repill, and the Aerolase laser. So they're doing all three. When they're really trying to get to results and see a difference, they're doing 3, stacking them on the same day. Our skin treatment, so in our office we have a membership program. You come in on a monthly basis and you can pick one of our 4 skin treatments: the peel, the laser, microneedling, or hydrofacial. Depending on your skin concerns and what's going on with your skin in that month, it will help determine which one we're doing. There's a boy today, he's always like telling me what he's going to come in and do next month, but when he comes in, like his skin reads different than what we thought a month ago. So we have to change up the game plan. So we're assessing your skin and we use the appropriate treatment based on what's going on in life and what your goals are. Again, for those that are okay with having a little bit of downtime or they want to get to the results faster, we're stacking them. Yes, you can do this black and brown skin. So yeah, our patients really love it. They're probably the happiest, the ones that are stacking it, just because they can see the results faster. Most recently, I've been doing the chemical peel. I love the bio-repill chemical peel. My skin was already like pretty healthy because I've been in this for a long time and I do the skin treatments. Like I know all the stuff to do. That chemical peel, when I very first did it, I was like, whoa, I saw a noticeable difference with one treatment like the next day. My husband, who I do all these things on him, he's always like, I can't tell a difference. He asked me for that pill routinely, the bio-repill. I was like, I thought you can never tell a difference with treatments. Why do you always ask me for this? He's like, I can tell. He's like, that's the biggest thing I've ever been able to tell. And he's like, it makes me look rich. I said, rich? He's like, what do you mean? He's like, it makes me look rich. He's like, and people treat me differently. Like my skin looks way better with it. So, and there's no downtime with that one. So like, guys, I love that. I love it. It says I have 41 messages. Can I please answer these? Okay. But yes, do microneedling as long as you know you're going to have a few days of downtime. Okay. Basic routine. Day, wash, vitamin C, moisturizer. Night, wash, moisturizer, tretinoin, moisturizer. Yes, JD, that's right. Sunscreen. You didn't add sunscreen in there. So in the morning time, basic routines. Guys, I also put our Jawline skin line. I really worked hard to get this on TikTok shop, and then I don't know how to even hook it up on the lives. But we, like the skin line that we use in our office, I made to like work hand in hand with treatments, or if people don't want treatments, like use this and it's going to be effective, and we've been using it for years. So that's our Jawline skin line. In the morning times, guys, you can wash if you want, or you don't have to wash, if you're sleeping on your back and your hair's off your face and all that. But yes, your vitamin C, moisturizer if you like, and your sunscreen. That's going to be the number one, your sunscreen. And then reapply it. Especially if you're driving around and it's sunny out, or you're sitting by a window at work and you're getting sun on your skin. Yes, black and brown people, you got to use it too. Every day, and reapply it. And then nighttime washing, yes. Tretinoin, yes. Moisturizer, yes. Those are the ones. We don't need it to be super complicated. We just want to be effective with our routine. Okay, is the lip filler safe? She's talking really all caps. I don't know what is in it. It's hyaluronic acid, Erin. Hyaluronic acid is a sugar molecule. We have hyaluronic acid in our body. It binds water. There's different type of hyaluronic acid fillers that we have FDA approved in the United States. These products go through so much regulation, and they are so clean. As long as I have been doing this, I've never seen anybody with an allergic reaction to any hyaluronic acids. Like I said, I've been doing this since 2013. Very well tolerated by patients. Which type of hyaluronic acid we choose really depends on you and your goals and how you present. So there's different fillers. I don't just pick the same one for every single person. I gotta assess what's going on their face and their goals. Yeah, so that's something that's important to know. But safe, yes. When we talked about safety earlier, when we're doing filler, we don't want to block blood flow off. So we're not trying to just shove a bunch of filler in there. I had some patient the other day. She had like really tiny, tiny lips. And she was like, give me 2 syringes. I was like, I can't. Maybe you can get a half today. Maybe let that settle, reassess, and we can do more later. Build it up. Understand when it comes to lip filler or filler anywhere in your face, there's limitations with these injectables. Just because, if you have super thin lips and you want to go bigger than mine, like your lip might not hold all of that. And then they're going to say it migrated. No, it's really not migrating. Migrating, slipping around your face. It's just overfilled. Like there was no more space here. So the provider kept trying to add more and more, and it's going outside of the lip border. That's when it looks puffy. I got to tell patients when we're doing this, there's limitations. We can't do too much. If it looks like it's trying to go, it's not going to fit. I don't want to keep shoving it in there, or it's going to be puffy. That's not what we want. It's going to distort your shape. Go slow when you do these things, guys. Do it. Let it settle. 6 to 8 weeks. Reassess. Then you can talk about adding more later. After you reassess, don't rush those things. 60 messages, guys. I'm going to be trying to do it. Hey, Shantae, I hope you're doing so great. Jowls scare me. Jowls, these right here. I know a lot of people do not like these. It makes the jawline look irregular. You can do a little bit of filler in front and or behind it to camouflage it. Sometimes we also go into the chin to elongate the jawline. Sometimes we'll do Botox into this area right here, this part of the neck, and it'll kind of help tighten along the jawline. Sometimes if they have a lot of fullness here, fat, we will permanently dissolve it with Kybella. So those are some different approaches we have to treating jowls. It varies per person. I got to assess the face. And then obviously there's surgeries. I'm going to try to answer all these questions, and I'm sure my husband's gonna be like, come get these kids. What did I do? I was 28 here. The first thing I did was under eye filler, cheek filler. I've done chin filler, temple filler. I have done Botox my whole face. I've now the past 3 years only been using the natural filler made entirely from my own growth factors and stem cells. I love filler. I'm not dissing filler. I just can't do filler right now because I got this baby that still drinks off of me. He's 2. Is that a baby? I don't know. I really like the natural one. I like regular filler too. I will say the natural filler, it's like a little less, it's just it doesn't take so much with like the settling of it. You don't feel it. You don't swell so long. So I like that. You can get back to life very easily with it. It's not gonna, it's not so temperamental as filler. But it just takes a little longer to see the natural one. And then skin treatments, I would say those are the main ones. Go hard in on taking care of your skin. I love skin treatments. If you don't want to do skin treatments, do your sunscreen, do your retinoid. Okay, 66 messages. Wish I was in LA. So yes, we've got offices, 2 in LA. We're in Mar Vista and Torrance, and then we just opened up in the Summerlin side of Las Vegas. Also, I have a lot of patients that tell me, just do a dang pop-up, Janelle. They're like, go. I see a lot of people. Every time I'm in clinic, somebody has flown from outside of LA, outside of California, outside of Vegas to come. But remember, we do the virtual consults before they come in. So we go through questions, goals, tips on what to expect, how to prep for treatments. These patients come in and they're ready. They're not coming in like, what am I going to do today? We've already built out a treatment plan. They already know all the pre and the post care. They are set. They are ready. They know they can bruise, but they've been doing all the things to minimize bruising and swelling. They know the cost. They got their coins together. They got their financing together. Like they're set. But yes, we see people from outside of the state every single day. Outside of the country, I see people from everywhere. So, okay. Can I have a free consultation? I live in LA. I'm very interested. We do virtual consultations are $150. In-person consultations with me are $350. You can ask me your questions on here. That's like the free ones if you wanna ask here. I usually will have it set up where you can invite yourself and do the consult. I just was running fast today because my husband's like, you can do your live now and I'll have the kids for like a short time. What's the best retinol product? Tretinoin, if you can tolerate it. And then if not, I love our Jossie Skin line, our Resurface RX. Hey Jerry, hope you're doing. I love when people have the curled lip. Oh, that was probably talking about that a long time ago. I know all these things, guys. I'm never telling people like do this. Like some people really like, what makes them unique. Some people are like, I love the bump on my nose. I'm not gonna be like straighten it out. Do what makes you feel the most beautiful, period. That's the most important thing. Some people will want to have a smaller lip, a bigger lip. It doesn't matter. I'm like, do what makes you feel beautiful. We're not trying to have every face look the same. We're not trying to morph everyone into the same. This is why we talk through you and your face and your goals and what's going on. Eli said location, Los Angeles, Mar Vista, Torrance, and Las Vegas on the Summerlin side. What about wrinkles on your knees? You can do your sunscreen, your retinoid at home. You can do microneedling. You can do the chemical peel and the laser. You can also do dilute radius for collagen stimulation. So all of those work for whatever 10. Okay, my friend gets Botox for migraines. Yes, it works very well. And this is FDA approved to treat migraines. We also do Botox for TMJ symptoms, for neck pain, for their traps that are over, too tight there. I've done it for calf slimming. I've done it for sweating in the palms and the soles of patients' feet, underneath their arms. So Botox is more than just like round lines and forehead lines. We use it all over the face and body, really depending on the person's goals. Okay, and you can do it on the hands. Can you do natural fill in your hands? Yes, you totally can. Okay, how do you address the forehead lines? You can do Botox. I think somebody was asking if, maybe this is what I was talking about, if they raise their forehead up a lot or because they're using this muscle to like lift their eyebrows. If they lift a lot, I have to talk to them like, do you have lines here that you're concerned with? If they are concerned, we have to go very, very conservative on their dose, very light on their dose. And then we also will probably do some at the tail end of their brow. This muscle usually closes in. So when we Botox it, it'll give a little bit of a lift. Okay. When do you have a virtual appointment? I don't see any more dates for all of 26. Hey, Lauren, I just told my team to add some on for Thursday because I saw that too. So you can call or text and they can help you with getting set up. But I tried to open up some. I was like, I can see some on Thursday. My son was supposed to be in a half day of school, but then they have extended care. So I was like, you stay and I will do work. Okay. What's your dream treatment plan for late 30s, Eastern European? Cost is not a concern. Tell me more about the face. I would say in general, skin treatments monthly, and I would probably be stacking these skin treatments like the peel and the laser and the microneedling if they can do some downtime. Stacking skin treatments and going hard on that and skin care. That's for everybody. And then I really like the natural filler. I'm like, it's not going to mess you up at all. It's going to help your body make new collagen. Think of that as a fertilizer and an investment in your future self. I think starting there, if you have volume loss, if you're noticing, under eyes, here, if you want a faster result, or if you've lost a lot of weight and they, then they really see a lot of volume loss, then maybe we go in with filler. But I think in general, natural filler, skin treatments, skin care, you're not going to go wrong. Oh, Botox is great, for frown forehead. Like I love Botox too, but I would go that way. That was for Violetta. I just don't want the 70 plus hours I work in a week to show on my face and neck. Yeah. So skin treatments, a little bit Botox, and then your natural filler and your skincare at home. Okay. I got Botox today, literally, and was hoping getting it around my jawline would help lift my neck skin. It didn't help as much as I thought. Should I get filler on the jaw? Heather, if you just did it today, you got to wait for 2 weeks to see the results. So when you guys do your Botox, just know it takes up to 2 weeks to see the full effect. So Heather, I don't know without seeing you, and wait after 2 weeks, then assess your face and then decide if it did what you wanted it to do. Or if you're looking for something a little bit more dramatic. I can't tell you if you should do filler on your jaw without seeing you because I just don't know. I will do filler on people's jawline to like make it look straighter, sometime in their chin to like make it look more defined. If your face is naturally very full, if there's like no separation from your neck to your jawline and you're a female, it's hard to like build that out because if we do too much, it will make you, it can look cool from the side, but like from the front, it will look boxy and square and wide. So that's where we have to go slow with it. But biggest thing, you said that you did your Botox today, literally. So I would wait your 2 weeks and then assess your face. Okay. I'm trying to make sure if I got just oh guys, I'm trying to answer these questions. God bless you all. I'm trying to get to them because I feel like I skipped them and I'm trying to scroll back. I'm not trying to miss any of them. Did I do something in my nose area? No, but I probably just had a little bit of pregnancy nose left. Gosh, if you look at my videos from 21 and 23, my face looks really full. It's because I get really swollen in my nose. Angela said, thank you. Okay, will filler help with drooping cheeks from weight loss? Yes, it can help restore volume or the natural filler. And when, to a certain degree, it's not going to do that. It's not going to pull you out the way like surgery can, but it's going to restore volume. And the way we place it, sometimes here and a little bit lateral, it'll make that highlight. Hey, Stacy, I hope you're doing so well. Look like your cheeks are lifted. When you've had a lot of weight loss, and this is very common the past few years, especially with like the help of weight loss medications. This is also where I'll tell people, like, don't go too fast on trying to like just shove a bunch of filler in your face. Remember, I say at least 2 sessions, give it some time, 6 to 8 weeks. So give it 2 months, let it settle, reassess. You can add more later. We don't want to overfill. We don't want things to look weird. If you're in the middle of your weight loss journey, you can start filler at that point, or you can start the natural one. So some people will come in, they're kind of like, I'm going to start losing weight. I want to start preventatively with a natural filler for that collagen stimulation, so I'm not so gaunt after I lose this weight. When people lose weight, all these spots I was telling you, under eyes, the smile lines, the corners of the mouth, they all look deeper and because they're like, have lost fat in their face. And they're like, everything is sinking. My body looks tight, but now my face looks like I'm old and these look sunken. I've been hearing the same story since like, when were they getting really hot? 2022? That's when a lot of people are like, I've been losing weight. So we deal with people in weight loss every day. Some people will start, earlier. Other people are going to wait till they finish all the way to their weight goals. It's really up to you on what your intent and goal is. Some people I say, hey, you want to wait? You're going to lose 30 pounds. You want to wait until we get to there? And they tell me, shut up. I'm tired of looking like this right now. I look saggy now. So do something about it now. It just depends on you. This is why we got to talk about you and your goals and what's going on. I hope I did not miss any questions. I'm trying to go back to them, but I can't even find where I left. She had the same question. Okay, what do I do for hollow under eyes and dark circles? Top recommendation. 29 years old, and I think somebody else had it. I just can't see what age they said. Natural filler. So yes, you can do that. The natural one, 29. I'm like, you're young. Do the natural one. As long as you're healthy and you got a good, healthy lifestyle, not smoking, drinking, drugging, doing all that, it's going to be harder for your body to make new collagen. But I would do that, or you can do traditional hyaluronic acid filler if you really want to see the results quicker. When you do this, if you do filler, you got to be a candidate for it. You don't want to have a lot of water retention around the eyes. Anybody that cries a lot, anybody that has bad allergies, anybody that says every day I wake up and I'm puffy, I'm like, oh no, don't do filler, because filler binds water. So if you do filler and you naturally get puffy, I'm like, oh, you're going to swell even more and it's going to look bad. It's going to look overfilled. Like, don't do that. Dark circles, the pigment, I don't know how to change the color of the skin. I hear my kids playing Christmas music. I'm going to go see them pretty soon. I can help to lift the volume loss, the sunkenness. When it is lifted, light reflects off the face a little bit brighter, and it's easier to conceal, to like use cover up to cover, as opposed to it like looking dark and sunken. It's harder to conceal. So that's something to keep in mind. But like to change the color of the skin, I don't know anything. And I've had patients over the years try different stuff. They're like, oh, I did this laser. Oh, I did a bleaching cream. Like all these things. And like they still say the pigment doesn't change or it comes back. That is one thing, even for my own self. Like I still have darker under eye skin relative to like my cheeks. If I put on makeup, I'll put on concealer there. But like it doesn't look as bad as like being sunken when I was sunken and dark. It just looked way worse. Okay. Hustle for passion. Interested in cheek filler and Nefertiti. Do you accept care credit? We don't have care credit in our office, but we have financing through Cherry. So we have it for our LA offices, our Vegas office. You can like pre-qualify. So there's a link. I think it's on my page, on my website, or we can send it to you. And then it's a soft credit check, so it's no hard credit pull, and they will tell you how much you qualify for, and then like it would break it down. You can do this over 6 months, 12 months, 24 months, and what your payments would be. Somebody told me the other day, hey, I did my thing, I did over a year, and my payments were only $123, and that made it so great for me, and I was able to do, she said her Botox lasts a year, but we also do like 150 plus units in her face, so it lasts her a long time. She broke it up over the year. Great. Okay. Okay. Let me see if there's any other, am I doing any Christmas specials in my Vegas location? We did something for Black Friday, but I don't have any Botox right now for Christmas. I will be, was I already in Vegas I can't remember. I'm going back to Vegas on the 16th of January, but our team is there seeing patients. I'm just like, get my days confused. How to address hooded eyes. So if your eyes are heavy, here you can do Botox to help to lift. Remember this muscle here closes in, so when we Botox here, it'll help give a lift. Sometimes we're going to do filler into the temples or the natural filler to help restore volume. When there's volume here, it can help look, it's not like that, but it helps like create this highlight so things can look a little bit more lifted. So sometimes we're doing that. So you can also do Botox right along the eyelid to help lift the eyelids, like right along the eyelash line. Okay, I hope. So if I get filler, is it a one-time thing or do I have to keep going? Lila said that. You don't have to keep going, but you will probably want to maintain your results. But it's not like you gotta keep going, like your face will continue to age. So if you want to maintain results, that's when you probably will want to continue to do your filler. When we do filler, guys, I say 1.5 to 2 years that it lasts. A lot of times when people come in, I'm like, hey, check in with me at that time. Sometimes they come in, it's 2 years later, and they're like, should I do my lips again or my nose again or whatever? I'm like, no, like it still looks perfect. We don't need to add just because. Like your body's going to metabolize it over time, but we don't want to just add unnecessarily. Okay. Does filler in the chin and jawline migrate? No, should not be doing this. Do not mess with your filler. When you get it, your filler is moldable for up to a month. So I tell patients, hands off. You don't need to touch it. It's pretty hard to move it at a month, but you can if you're doing like strong gua sha. Just leave your hands off, sleep on your back, a little propped up, helps with swelling, and just leave it. You know, people will say, I feel little bumps. I'm like, I know. They're like, I don't see it. Or if I go like this, I see a bump right here. I'm like, leave it. It will settle in 6 to 8 weeks. Like, in that timeline, if it's there, I'll dissolve it. When they come back for their follow-up 6 to 8 weeks later, they're like, oh yeah, that bump went down. They're like, it went. I'm like, yeah, I know. It just has to like mesh in with your skin. So don't overfill. Don't do too much at once. That's a big thing. And don't mess with it. Don't move it around. Okay. I think I made it back to where I was earlier. Now I'm trying to go to where I missed. So we talked about retinoid. We talked about sunscreen. Check out the Jossie Skin line, guys. I love it. That's my line. We talked about okay. I did not do anything to my nose. Michelle said I'm beautiful. Thank you so much. Okay, what do you do about under eye bags? So if you have like little fat pads that show, there's no way to non-surgically take them away. Surgically, you can tighten them or take them out. So I'll tell people if you're open to that, go talk to a surgeon about that. We can camouflage the fat pads usually with filler or the natural filler. So that's when we go like underneath that fat pad, we bring up the skin and we help hide it. Usually, guys, I'm like flipping through photos, like before and after photos and showing different patients, but you can check at the top of my page and you can go under eyes and you can see different eyes. Where does the wellness fit in? In our office, we have a weight loss and wellness program. We've got vitamin B shots, and then these things with collagen stimulation. That is what we're doing. Okay. PRP versus under eye filler. I've heard mixed opinions. They're both great. Filler is going to give you your immediate result. Your PRP is going to be made entirely from you and your body making new collagen over time. Which chemical pill are you talking about that you do? I've never done a pill open to this. Claudia, I love the Bio Repill chemical pill. No downtime with it. Safe for all skin types and tones. You glow like immediately and even the next day. So I love that one. Microneedling versus chemical pill deets, please. Microneedling more if you're having like acne scarring, texture. I will go there. A lot of times the patients are combining them. So it's not always like a one or the other. It may be like, maybe it's one or the other in this moment, but we can combine those the same day. They're working at different depths in the skin, but microneedling, if they really have acne scars, skin texture concerns, that's where I'll go like make microneedling as a top recommendation. Pigmentation, wanting a glow, wanting brightening, acne, that's where I'm going to go with the chemical peel. You don't want to do microneedling if you have active acne on the skin because you can spread it. Okay, it still says I have 59 messages. I'm trying, guys. I'm trying. How can I book with you? T-Show, you can do it at the top of my page. You can call or text the number there or through the link. Okay, can I talk about anything else other than filling your cheeks to fill the dents? The natural filler. Yes, you can do that one. You can do the natural filler. And then surgically, you can do like fat transfer. I just don't do surgery, so I don't want to talk too much out of my lane there. Thoughts on filler or natural fillers in the buttocks? It's going to take a lot with either of them. Like Sculptra, all those dilute radius I've done on people. It just takes a lot. That's the only thing. Torrance, I hope you're doing so great, Jay. How long does a natural filler take? For us to like prep it, it takes like 25 minutes. Like the blood draw, the spinning, the separating out your growth factors and stem cells and heating. It takes like 25 minutes. To inject it takes just a few minutes. It really doesn't take too much. Pop-up on DC. Okay, Liza, my patients have really been getting on me about these different pop-up places. You guys, they have said Houston is like the main. I see so many people from Houston. New York, I get a lot of requests, and I see a lot of patients from there. Those are the top two. And the Bay, a lot of people come from there. I mean, that's so close. So I'll be working on that this year. Should I do like 2 or 3 pop-ups? And I have another patient that is up my throat. Oh, hey Nettie, that's so fun. About doing Aspen. She's like, just go. Black Ski Week, and she's like, just go over there. So I will let you know. PRP, PRF is the natural filler you use. Yes, that is when we're heating and cooling it and mixing it and putting it in your skin. How long does it last? The goal with this is your body making new collagen. New collagen can take up to 6 months to make. Once you got new collagen in those areas, it can last 1.5 years, 2 years. But you will keep aging. The healthier you are, the better your body is going to maintain that collagen. If you are smoking, drinking, drugging, no, your body's not going to maintain that collagen that well. 66 messages. I'm trying, guys. Can you explain, Just Jay said, the differences in the 2 pics at the top? Yes. So over here, I was 28 years old. This was after my first kid. He's 11 now. This is after, this was maybe 2 or 3 years ago. I can't remember. This is before my last one. My last one is 2 years old. So in between here, in this photo, I was feeling very like sunken looking, tired, gaunt. That first baby, I breastfeed them all for 2 to 2.5 years, and I've got 3 of them. So they like suck fat out of my face. I felt really hollow underneath my eyes and through here, my temples. So that is where I did filler. And I've done the natural filler to maintain the results over the past few years. I've also done filler into my chin to elongate my jawline, corners of my mouth. So it's really for me to restore volume. Also, the past few years, really going hard in on my skin care, and like my skin treatments. So that's the biggest one. Just 10 years younger, but I looked more sunken. I felt like I looked a little bit more haggard just because I was having no fat in my face. Anyone caught on what she said about the best retinol? She said that fast. Okay, sorry. Tretinoin, Retin-A prescription, or you can do our Jawline skin line, JASISKIN. And you can go to our page. So on our page, we just got we rebranded everything, guys. So everything has been under my name since like 21. It was Janelle Beauty Aesthetics. I never really made that name up. The website people did. But I was never intending to have like all of these other providers that I think are amazing and all these treatments that we offer now. So the new clinic is Jawline Skin and Wellness. So we just switched our website, our medical record, like in October, November. So Jawline Skin is our website. That's our clinic name. But if you search up my name, Janelle Beauty, you will be able to find the patient before and afters, the reviews, all that stuff that we've built up over the past few years. Okay, honestly, I'm breastfeeding, so I don't know what to use. Any suggestions? Sunscreen. And yeah, you can use your sunscreen. That's the main one right now. You can do your vitamin C in the morning time, hyaluronic acid, our recovery boost serum. That one is excellent for like hydration, for any skin irritation, any redness. And then in the office, the natural filler we will do. Yeah, those are the ones. How do you charge per pin? I don't know if you mean like per skin pin treatment. If you're talking about skin treatments, for any of our skin treatments, as a solo treatment, they're $550. In our membership, they're $3.99. So you come in on a monthly basis, they're $3.99. It is a 6-month minimum for the treatments when we're doing the membership program, but that brings the cost down a lot. We also have packages of 4. Like I said, some people are like, oh, I can't come on a monthly basis, I'm from out of town. So they'll do a package that brings it down to $2,000 a package of 4, so it's $500 a treatment. But we're trying to do that because like one treatment is not it. Like I'm trying to discourage patients from doing one. I'm like, you can do one, but like that's not the point. Like we didn't get to your skin overnight. Like you got to give this time, and like these treatments are progressively going to get better, compounded when they're done over time. Like you can see some with one, but it's really doing a series of these treatments where people are like, whoa, like they are starting to see their skin glow. They're getting compliments. We can visibly see the improvements in photos. Like that's the whole point. Or did you mean when you're saying, do I charge per pin, maybe mean syringes? Syringes are $8.75 per syringe with our nurses. They're $9.75 a syringe with me. Okay, 75 messages, guys. I'm trying to catch up. Easy Joe, I love it. Hey Frida, hope you're doing good. I got my DAOs. It makes me talk funny. Is there a way to do it lighter, or should I just not? Darcy, maybe they hit a muscle that we're not trying to hit because there's a thin muscle there, and it lays next to another muscle that connects to the mouth. It'll wear off, or new studies have shown like they can inject some saline in there and it can help speed up the process so it can wear off faster. Injector from Philly here. Just wanted to say I love your work. Hey Taylene, I hope you're doing so well. Also Injectors, if you ever have any questions, like we are in this together. Call us, text us, like let me know if you have any questions ever. We are here to work together. Oh, and then I got this one. Heather, I answered you earlier about Botox in the neck. Oh, gosh. Then it made my messages go. What do you think about Morpheus 8 and how far apart? Nope. I've heard every 6 weeks. I wouldn't. I've heard too many of my patients that have done it. I don't offer it in our office, but too many of them that have done it that have said like meh on the results. And so I don't really recommend it. Any advice for getting an aesthetics field? A lot of places want experienced injectors only. I have worked with, people, I've taught people from zero and they are completely booked and they are excellent injectors. I think the biggest thing is like, keep going, like keep trying. If you want it, you can get it. Just, you gotta be putting yourself out there. You can do trainings, but like keep showing up to these jobs and like being willing to train, and like, it will happen. It can happen. I love skincare. I'm breastfeeding. I don't know what to use. Honestly, we said that. And you said you're 40. Sunscreen, vitamin C. Also get our resurface. No. Do recovery boost. Wait a little bit until you're doing your retinoid. Okay. Let me see if there's other ones. I'm trying to go back up. Can you do facials if you got Botox and fillers? Yes. When I'm in Vegas. I go to Vegas like once, maybe twice a month. My next time is going to be January 16th. January. I just bought some tickets for like January, February, March. But go in there and see Samantha. You guys do your virtual consults with her. She is excellent. There's so many patients that are like, I want to only talk to Janelle. And then they have her for the virtual consult. And then they're like, oh, I actually want to reroute my flight and go see Samantha. Like, you will love her. She's amazing. I love her. I trust her with my face. Alexis, also amazing, excellent. And our advanced esthetician is Karina. So the Vegas team is awesome. Okay, let me see. Can you say anything about Botox and fillers for acne? Not too much about that. I can say really, I would say doing more of your skin treatments and your skincare for acne. Acne, do the laser, and the chemical peel. But the laser, those are excellent for acne. Retinoid is excellent for acne. We prescribe in our office clindamycin if needed. Red light therapy, excellent for acne. Our acne wash, blemish cleanse is excellent for acne. So like we gotta talk through it, and also like what's causing your acne? What are your triggers? How can we minimize those? We treat a lot of acne in our office. We have Niani on our team, black dermatology nurse practitioner, excellent. Anybody in the office is excellent, guys. You will love the team. So we manage a lot of acne in our office, but for Botox and filler for it, not so much. But the skin treatments, yes. Okay, I think, is it bad to get subcision for acne scarring after facial balancing? Not necessarily, but you want to give it some time for your filler to settle, like at least 8 weeks. Okay. And then we talked about, Nettie said, thoughts are natural fillers or traditional fillers in the rear. Both of them are going to take time. You can do dilute radius for like get a little bit of an instant lift, but also get the collagen stimulation. They take time and they take a lot of product. That was what I was going to say. And then Shamar, I got your question. I think she said with her it's 300. What were they saying? I don't know which one. How much are the consultations? Virtual consults, 150. In person, 350. Guys, but the in person, it's like we try to tell people do the virtual first, because in person they'll come in, and then if they're like, oh, I didn't know I could bruise today, I'm like, oh, like your 350 just goes towards your consult that day. So it's like, just if you do the virtual, they can help you to be ready for your appointment. Unless you know, sometimes the people that will do the in-person, they're like, I've been following you. I know all the things. I did my pre-care. I did my post-care. Maybe they sent me some pictures. They're like, I am ready. I am set. I want to do my treatment there. This is a good time. We can totally do that. Okay. I think I got them. I tried to get them all, guys. I will be back on. Oh, somebody said, best laser for stubborn hyperpigmentation and black skin. I've done Pico. I've also done pills. Are you doing sunscreen? That's my first question. Sunscreen and reapplying. And then sometimes we're going to be doing your tretinoin and or your hydroquinone. We love the Aerolase mixed with the Bio Repill for pigment, but we're also doing those other things. But sunscreen, if you're like not wearing sunscreen, not even worth it. I don't want to take your money. Like I will tell people, yeah. Have I heard of Teoxane RHA? Yes, we don't use RHA in our office, but that's another filler brand. Not bad. I just use other products. Okay, I think I got them all. I think I got them. I hope I got them. Okay. If you have other questions, I think I've been on here for a long time. If you have other questions, call or text the team, set up a virtual consult. I will be on here. I was doing lives like every day for a few weeks. And then I was just like running out of time. And it's like the holiday time and the patients, everybody's coming in right now and getting ready for the holidays. But you don't want to be waiting last minute to get your treatments, guys. So like right now I'm talking to people. I'm like, we need to be getting ready for Q1 events. Your Super Bowl, your NBA All-Star Weekend, your Coachella's coming in the spring, your Valentine's Day, your ski weekends. Like we need to be prepping for that. Like it is, I mean, you can do your Christmas prep, but it's like we got not that much time before Christmas, and you can be bruised and you can be swollen. So we want to be planning months in advance before your events to make sure you show up looking your freshest self. Okay, if you think of other questions, call or text. I will try to be on here to do more lives, and then we can do our virtual consults and any other thing else you need. Please let me know. I appreciate you guys. God bless you. I will talk to you soon, and have a great night. Goodbye.